Action. Good morning.
Good morning, sir. How are you doing today?
I'm doing fantastic. What about you?
I'm doing great. My name's Elena. I'll be your nurse today.
Lucky me.
Aw. Can you tell me what your name and date of birth is?
Shelby Rice, May 29th, 1992.
Yes. Okay. And can you tell me where you are?
The hospital.
Okay. And why are you here?
For a checkup.
All right. That sounds about right. Can you tell me? I know it's a silly question, but who's the governor of Alabama?
That's a hard one. Kay Ivey.
It sure is. That's right. Okay. And so today, what your doctor has ordered is a head-to-toe assessment. I'll just be looking you over, and I'll be taking your vital signs. Does that sound okay?
Sounds perfect.
Okay. All right, and now I'm going to take his vital signs. What I'm going to get is his blood pressure, pulse oximetry, and temperature. Okay, we're done with that. I'll check his apical pulse when we get to the cardiac assessment. Okay, I'm going to put on my gloves, and I'm going to just feel your head. I'm checking his scalp for smoothness, any spots that feel raised or swollen. I don't feel any. Okay, and now I'm gonna check his hair, check it for infestations or dandruff.
I've used head and shoulders my whole life.
It seems to be working. I don't see any dandruff. Okay, I'm gonna check the beard. Same thing. Yep, it's working good. Okay, now I'm gonna do an eye assessment. Now the light can be a little bit discomforting. I apologize for that. If you can just look forward for me. All right, pupillary constriction. Can you look at my tip of my pen light now? Okay, and keep your head still. Perfect. Okay, keep looking. Checking cardinal gaze. Alright, and we have convergence, accommodation, and perla. Good. Okay, now I'm going to check your nose and your ears. If you can just stay there. Alright. Any trouble breathing?
No, ma'am.
Okay. Alright, no excess drainage. Little bitty hairs to the nares.
That's embarrassing. I'm sorry. I thought I got all those.
You got most of them. They're just small. Okay, so one more thing. Can you open your mouth for me? Alright. Mucous membranes and tongue are moist and pink. Can you say ah? Okay, that's good. Alright, dentition looks clear, looks good, and no missing teeth. The uvula Rosenfeld with the eye. Tonsils are present, not swollen. Okay, now I'm going to just feel your face. Any pressure here?
No, ma'am.
Alright, look at me. Lacrimal ducts are pink and moist. Okay. Alright, now I'm going to feel your throat, okay? I'm just going to put my hands on your neck. Lymph nodes are present, but not swollen. Trachea is midline. Okay, I'm feeling. Alright, and as I'm looking at him, I can see that his nose is midline. His eyes and ears are symmetric. Right, and his carotid pulse is +2 and with a regular rhythm. Okay, and if you don't mind, sir, will you take off your shirt for me? Okay, have a seat. Okay, I'm going to assess your arms first. I'm inspecting them. I see that you have about a dime-sized bruise there on your right upper arm. Can you tell me what that is?
It's a bruise from jiu-jitsu.
Bruise from jiu-jitsu. You touch it. It's not swollen, not hot to touch. Okay. When did you get that bruise?
Earlier today.
Earlier today. Did you lay the smack down? Or did they get you?
They got me.
They got you today?
Yeah.
Okay, maybe better luck tomorrow, huh?
Better luck tomorrow.
Okay. I'm gonna tell me if this hurts at all. Any pain?
No, ma'am.
Okay, no crepitus or grating there. I'm gonna feel here in your brachial pulse. Alright, it's present. I'm going to do the same to the other arm. Inspecting. Tell me any pain. Good. Alright, no crepitus or grating there either. Alright, brachial feel his pulses present. I'm going to feel both radial pulses. Nice, +2 and even bilaterally. Alright, checking skin turgor. Alright, checking capillary refill. Alright, and those are both within 3 seconds, very brisk. Okay, alright, we're done with the arms. So can you put your arms out like this? And close your eyes. Alright, and no drift. Put them down. Good job. Alright, and hold my hands. Squeeze. Alright, good. Good strong grip strength bilaterally. Okay, now I'm going to listen to your heart. You can just sit comfortably as you can. Alright, and take sternal notch and go down 2, over 2 to the pulmonic. Alright, and across the way. Over 2. I'm sorry, that was aortic. I misspoke. Aortic and now pulmonic. Down, Erb's point or second pulmonic. Tricuspid. Mitral. Alright, and while I'm here, I'm going to listen for a full minute for his apical pulse. But for video purposing, I'm just going to do 10 seconds times 6. And that's 66 per minute. We'll listen to epigastric. Okay, I'm going to turn it around, listen to the bell for murmurs. Okay, now we're going to listen to your lungs. So when you feel my stethoscope, just breathe in and out. Okay, good even breath. Now. Okay, and well, I'm over here. I'll do that. Will you stand up for me for a second, sir? Okay, and I'm just going to, I'm right here, going to feel his ribs for costal angle, just like that, okay? You can turn around for me and have a seat. I'm gonna listen and assess his back and breathing sounds. Okay. Just in and out, just as before. Almost done. Alright, last one. Okay, alright, and just feeling your spine. Okay. Alright, you can stand up and you can go back to your seat, sir. Alright, and now, if you don't mind, will you lay down for me? And I'm just going to listen and look at your stomach for a moment. Okay, I'm looking at his stomach, his abdomen, and I see that it's non-distended, looks smooth, no rigidity observed upon inspection. Now I'm going to listen. Do you have any issues with your stomach?
No, ma'am.
No? Okay. I'm just gonna listen. Okay, vowel sounds present times 4 quadrants. I'm going to feel with my hands now, okay? Just tell me if you feel any pain. Any pain or tenderness?
I don't feel anything. Pain.
No pain?
No pain. No pain. No pain.
Okay. Alright, and you can sit up for me. Alright, and put your legs out. I'm gonna just look at your legs. I'm gonna feel, you can relax them, put them down. Feel your popliteal artery. And I was looking, they look about the same in length. Popliteal artery is present. Okay. Now, I see that we have a right leg prosthesis. Would you like to take off your prosthetic for this appointment?
If I could, I'd like to keep it on.
You can keep it on, that's fine. Can you tell me a little bit about it though?
I'm a silent patient. Had an amputation of my right foot, and all I have left is my ankle.
Okay. Do you have any sores or problems with it right now?
No, ma'am.
Okay. Alright, and now during also from observation, I see that the skin color is appropriate for a still. No heat or cold areas, temperature is normal, and I see that your toes also have some disfigurement.
Yep, it was amputated as well. They actually took a portion of my gluteus maximus and put it on there to cover up the skin graft you see.
Okay, so you have your great toe, and we're missing the other digits to the left foot, and then we have the right leg
It was the
amputation.
same accident.
Okay, and how long ago was this?
27 years.
27 years ago. Okay. All right, I'm just going to feel for pulse. Okay. All right, fetal pulses are present. Anterior tibialis and posterior tibial are present, and +2 on the top and +1 on the back. Okay, and is there anything else you'd like to, any other problems you'd like to discuss during this appointment?
No, ma'am.
Okay, all right, I hope that wasn't too hard or terrible for you. You have a great day.
Thank you, ma'am.
You're welcome.